My training is as a rheumatologist, immunologist, molecular biologist. 9 years ago, Sue Manzi, Dr. Manzi, and I decided to relocate to Allegheny Health Network. And we did so because we had established a very successful Lupus Center of Excellence, and we wanted to take that model to address all autoimmune diseases.
So my role is as the director of the Lupus Center of Excellence there, but I'm also the co-founder of the Autoimmunity Institute with Dr. Ahearn.
We have found in just our first year at the Autoimmunity Institute that patients from all over the country are struggling with both diagnosis of their disease as well as their treatment regimen.
The patients get lost in the healthcare system. They go from one specialist to the next, and it's hard for them to navigate. So we brought together in the Autoimmunity Institute 13, now it's up to 15 actually, subspecialists or special doctors that work under one roof and can see people that have a variety of different problems, make an accurate diagnosis, and get treatment started quickly.
We've been getting referrals from all over the world just since May. Florida, Alaska, North Carolina, Virginia, Chicago, Rhode Island, New York. Last week I was on the phone to a patient with RP in Beirut.
Having all those specialists there, you can diagnose and manage any of the diseases. And there's more than 100 different autoimmune diseases, 50 million people in the United States.
It doesn't matter if it's a rare disease if you have it. If it's a lupus patient or a rheumatoid arthritis patient, they don't care if it's common or rare. The family doesn't care how common or rare it is. It's like precision medicine. It's you.
But the responses are generally this: they get it. Right? We came here, they listened, the doctors understood. For the first time, I felt like they got what I was feeling and how terrible and devastating this disease has been. And then when they leave, we can give them a very comprehensive plan for treatment. So it's been wonderful to hear how happy they are, and I think how satisfied they are with being able to come to our institute.
I look forward to doing everything we can to kick ass and kill this disease. So thank you. Wow, I'm overwhelmed already. I heard there was a great interest among this community in autoimmune disease, but I had absolutely no idea. And so welcome, thank you for being here, and an enormous thanks to Mike and Nancy Lynn and Dave Bammert and Dean Robinia for inviting us to share today with you and tell you about what we're doing to kill autoimmune diseases. We are absolutely thrilled. I can speak for Dr. Manzi and myself, absolutely thrilled to be here at this spectacular venue, enjoying exceptional hospitality and celebrating this momentous occasion. So first of all, you'll notice that we have changed our title. As we put the presentation together, we realized many others could tell you about autoimmune disease when the immune system attacks itself, but we wanted to be able to share with you a perspective that we think we are uniquely able to tell you about in what we're doing in this fight. So why are we here? So this is Jessica. Jessica is a lupus patient, and several years ago, when she was 21, the night before Thanksgiving, she came to our emergency room short of breath. And her doctor was Dr. Manzi, and so the ER doc called Dr. Manzi and said, Jessica's here, and she's short of breath, and Dr. Manzi said, well, she needs to be admitted to the hospital, and Jessica said, well, can I just go home for Thanksgiving dinner, and I'll come back tomorrow. So she never made it out of the emergency room. She had a massive MI, and she died with severe coronary artery disease that actually Dr. Manzi pioneered. And and recognized as being a risk factor in women with lupus, where they have a 50-fold increased risk of heart disease. So why are we here? We are here to make sure that we don't have more Jessicas, because we know we have patients that aren't going to be here tomorrow. So we're here for Jessica, so there's no more Jessicas with lupus or with any of the 100-plus autoimmune diseases, and we are determined. So you've heard a little bit about this, and you'll hear more about this theme. So this venture that I'm going to tell you about, myself and Dr. Manzi, started more than 10 years ago. And more recently, we've had the privilege to enter into an inspiring and powerful partnership with the Race for RP and the RP Support and Awareness Foundation. So you're going to be hearing much more about that. And I'd like to know how they got the Wildcat on top of the car. That's impressive. So this is going to be a tag team. I'm going to turn things over to Dr. Manzi, and then I'll be back shortly to finish up.
Good afternoon. It is such a privilege to be here. I cannot tell you. First of all, I've never been to the Upper Peninsula before, and it is beautiful. So I plan to be back, but I said I want to come back when it's snowing, because I like snow. So I'll be back. So my job is in a short amount of time to give you a little bit of an overview about what autoimmune diseases are and what autoimmunity means. Because regardless of the autoimmune disease you have, you share very similar pieces of the puzzle. And if we can solve in one, we're going to impact another. And so when people say to me, what is autoimmunity? I always say a picture is worth 1,000 words. And so this is the picture we use. This was taken from the Baltimore Sun years ago, and it is a picture depicting lupus, but you could put any autoimmune disease in this picture. So what do you see here, right? What you see is a castle, and you see a woman inside the castle. She should be protected, right? The artillery should be pointing out. But in autoimmunity, you can see the artillery is pointing in. It's facing her. And it's really important because it does depict this idea of autoimmune diseases being what we call diseases of self-sabotage. You see also that it's a woman because, interestingly, the vast majority of autoimmune diseases tend to be more common in women for a lot of different reasons. But what's striking about this is you'd say, why is it? It's very hard for your immune system to be able to be your defense against invaders that come in, bacteria, viruses, and be able to fight and attack them, but not harm you, right? It's like an army fighting against an enemy, everybody's running around, and you've got to make sure you can tell the difference between the enemy and an ally. And sometimes the immune system doesn't get it right. And unfortunately, there are people whose immune systems are not as good at distinguishing self from foreign invaders. And that's probably, and I'll show you why that might be the case, but a lot of it has to do with your genetics, right? It's things you can't necessarily control, but there are things you can control that may prevent some of that. The other interesting thing is if I ask all of you right now to point to different organ systems in your body, you'd probably do a pretty good job. If I said point to your brain, you'd point. Point to your heart, point to your lungs. You have a pretty good sense of where your organs are. If I said point to your immune system, where are you going to point? And if you can't, you're just like all of us. Because the immune system, and this next slide sort of shows it if you can see on the left here, your immune system is this intricate, really system of cells that travel through the body that are there as their surveillance cameras, making sure things don't get in that don't belong. And there are interesting immune organs, like your tonsils and adenoids are actually immune organs. Your thymus, which sort of it goes away or generally goes away as you get older. These lymph nodes and your appendix and inside your bone marrow and your spleen are all lymph tissues. And depending on heredity, so your genetics, these cells, lifestyle plays a big role, and we'll talk a little bit about that. Hormonal influence is probably very important, particularly with the predominance of women, and environmental factors. When these things come together in a certain way, the immune system becomes dysregulated, and different diseases can occur. Multiple sclerosis, if the attack is on the brain, if the attack is on the joints, rheumatoid arthritis, if the attack is on the cartilage, relapsing polychondritis, or lupus, the attack can be anywhere. And then a variety of different symptoms. You can get a rash, you may get heart issues. Depending on where the attack is, the symptoms can be different. Now, this next slide, I'm going to make you an immunologist overnight, okay? And so don't get scared when you see it, because I'll walk you through it, but it truly sums up everything and why this happens. Okay, so now that you get over the shock of seeing it, but so basically, if you think here's a bacterium, that could be a virus, that could be anything that gets into your immune system. The cell that is most responsible for seeing that and attacking it is the B cell. It's a lymphocyte, it's a white blood cell that's an important immune cell. When the B cell sees the bacterium, it makes antibodies, all these circles, to attach onto the bacterium, and what happens when it attaches are these macrophages engulf it and get rid of it. And that's why you get better. After you've been sick, you can actually get better. Your immune system is working beautifully. But what if the B cell starts to make antigens to self? This is self down here. It should be ignoring self, but it may not. And those antibodies are called autoantibodies. And those are antibodies made to self. And fortunately, we can measure some of those. That becomes a problem, because now the attack is going to happen against you and not this bacterium. So this is pretty much autoimmunity in a nutshell. And interestingly, as I talk to you, there's great gender disparity in autoimmune diseases, so more women than men. You can see here that autoimmune thyroid disease, Hashimoto's, is the most striking. There's 50 women for every one male with Hashimoto's. There's also Graves', which is a hyperactive thyroid. Lupus, you can see, this is women to men, right? You can see in all of these diseases, there's more women than men. And people think it has to do with hormones. So testosterone, for example, tends to suppress the immune system, where estrogen can sometimes act as an activator. So it may be in part hormonally regulated. But again, when we say there's over 100 autoimmune diseases, it's because that attack can be on any of these organs. And there you see the trachea, because unfortunately there's cartilage in the trachea, and so the relapsing polychondritis patients can have difficulty breathing because the cartilage becomes inflamed in the breathing tube. And all of these different organs can be attacked. There's the pancreas as well for type 1 diabetes. Now, why do autoimmune diseases happen? People always ask that. Anytime I diagnose someone with lupus or another, the first thing out of it, because a lot of times they're young women. They're 20 years old, they're in the prime of their life, and it's always, why me? So a big part of it, without a doubt, we're learning are genetic factors. And interestingly, most of them will say, well, no one else in my family has lupus. And I always say they don't have to have lupus, but I bet someone has another autoimmune condition. And then they're, well, my aunt has thyroid, oh, and I have a cousin with, Crohn's disease. So you start looking, there's a sprinkling, if you will, of autoimmune diseases, not necessarily the same disease. And so genetics are clearly important. But environmental triggers are important as well. So for example, sun exposure can trigger lupus. Photosensitivity patients have. Even environmental toxins like mercury, in some instances, have been associated with rheumatoid arthritis or other autoimmune diseases. So there's definitely things in the environment. The gender factors we talked about, obviously, as well, women versus men. But lifestyle, believe it or not, is important. Many, many studies have shown that cigarette smoking tends to increase risk for rheumatoid arthritis. There's smoke exposure has been shown, just exposure to smoke has been shown to increase childhood onset autoimmune diseases. There's one called dermatomyositis, which is skin and muscle. So lifestyle becomes really important. Even socioeconomic status, poverty, and different conditions tend to make it worse, as well as stress. So regardless of what autoimmune disease you have, you can't mess with your genetics. It is what it is, right? You inherited those. But you certainly could become much better at understanding these other triggers. So now I just want to run through a little bit, just a few autoimmune diseases to talk about. I mean, I know most of you know this. Hashimoto's is probably one of the most common, as we talked about before, and that's where the immune system targets the thyroid, can cause enlargement of the thyroid and an underactive thyroid. But not to forget that you can also have what's called Graves' disease, where the thyroid is overactive as well. And in these cases, the nice thing about Hashimoto's is that it's treatable, because all you have to do is replace the hormone, the thyroid hormone. In Graves' disease, usually you have to ablate. They kind of give you radioactive iodine or ablation of the thyroid, and then they replace it. So relatively, in the scheme of autoimmune diseases, treatable. There's another large category of autoimmune diseases called vasculitis. These are really intriguing because what they do is they target the blood vessels in the body, and they cause inflammation of the blood vessels and can lead to some very devastating autoimmune diseases. The one we usually talk about most is one called Wegener's granulomatosis. The new name now is granulomatosis with polyangiitis, but look at this. This disease is where the immune system targets the sinuses, and when it targets the sinuses, it can cause collapse of the nose. And you can see this saddle nose deformity. And you can see deformities in relapsing polychondritis as well. This is a CAT scan, and it's kind of a cross-sectional CAT scan. These are the lungs on either side. This is the heart. But you see these big white nodules there are actually involvement in the lungs, because the lung was targeted and can cause shortness of breath, bleeding in the lungs, and respiratory distress. These are biopsies of kidneys showing, again, inflammation in the kidneys that can lead to kidney failure. So this is a systemic vasculitis because of an attack on blood vessels in these various organs. Wegener's, there's a new treatment out now for that, a treatment called rituximab, which is a very targeted treatment that has made a huge impact on this particular disease, which has been great in the most recent years. So early rheumatoid arthritis is one of the more common, certainly more common than lupus or relapsing polychondritis. And when you catch someone early with rheumatoid arthritis, they have swelling in the joints. And you may not be able to appreciate this, but do you see how swollen these joints are of those fingers? And if that disease is not identified early and treated, that's when you get these deformities that happen, because rheumatoid arthritis causes destruction of the joints, and they end up getting deformities and very difficult being able to function. The most, and I have to say probably the biggest leap forward in treatment of autoimmune diseases have been in rheumatoid arthritis. You see these commercials on TV all the time, right? Xeljanz, Humira, Enbrel. Those treatments, those biologic treatments that are targeting those B cells or the inflammatory markers that are out there, the inflammatory proteins that are causing the damage, those treatments are so effective. I always tell our trainees, they're never going to see this again. Because patients that are now treated, even if you get them early, will never have this. Because these medications can melt the disease away. That has been a dramatic improvement. We have to do exactly the same in all the other diseases as well. So it's possible to do. It really requires a focus. Psoriasis is an autoimmune disease. Now, psoriasis you can see, right, on the hands or on the skin, but patients can also get an arthritis associated with psoriasis that can be very devastating. Now, the good news here is that a lot of those medications that I told you about, Humira, Enbrel, that you see on TV, that treat rheumatoid arthritis are highly effective as well for both psoriasis and the arthritis associated with it. So this, too, they've come a long way in terms of treatment. There's also many other medications where you have people coming in that had terrible psoriasis. They're getting put on one of these new agents. They come in and their skin is totally clear. So great advancement. So that's good for us. Now, I mentioned Lyme disease, and I looked this up. So you guys are getting increasing numbers of Lyme cases in the Upper Peninsula. I was watching numbers grow in Michigan. Pennsylvania is endemic. I mean, we have deer that come up and, come up to our front door. And, the deer tick is really the vector that carries the Lyme, which is a bacteria that is in that tick that is on a deer. If you have a dog, it often jumps onto your dog and then can infect people. Now, Lyme is treatable. And you would say, why? That's an infectious disease. Why do you have it up in autoimmunity? Because, in fact, some of the manifestations of Lyme can mimic autoimmune diseases, arthritis, fatigue, brain fog problems. But also, this is the classic rash. It's called erythema chronica migrans rash. It's that bullet rash that you can get from the tick. But if you don't treat Lyme effectively, you can get a post-Lyme syndrome, which can be very much like an autoimmune disease that we have to treat as such. So recognizing and treating Lyme is important, and it'll probably become even more important here in the near future. And I show you IgA nephropathy just because I find this something interesting for you to appreciate. This is, and it's probably hard to see, but this is a biopsy of your kidney. If I took a biopsy of your kidney and put it on a slide, this is what it would look like. It's a glomerulus. And all this green is when we stain that biopsy kidney for autoantibodies, for antibodies that are targeting the kidney. So we can actually see that attack on self on a slide that shows the autoimmune event happening. I do want to remind people inflammatory bowel disease is autoimmune, Crohn's disease, ulcerative colitis, and often runs in families as well. Again, and I think we'll talk about this more, but the treatment for Crohn's and ulcerative colitis is very similar to the treatment for rheumatoid arthritis. So you can see here how getting better therapies in certain areas are going to carry over into other autoimmune diseases. And we share, interestingly, the genetic background of people with inflammatory bowel disease looks very much like rheumatoid arthritis. So we all start coming together in terms of diseases. Celiac, autoimmune. How many people have celiac disease now? Gluten intolerance. We never even knew this existed 10 years ago. Poor people were struggling with terrible GI issues and weight loss and vitamin D deficiency and bone fractures because they couldn't absorb. And now we know, you talk about an environmental factor, it's the whole grain, it's gluten. And these people have antibodies that attack parts of their gut that make them sensitive to gluten. Now, again, if you can avoid gluten, you've got treatment for celiac, which is quite good. And fortunately now, you can't go anywhere without seeing gluten-free. So it's become much more a part of the mainstream. Type 1 diabetes. People don't think of type 1 diabetes as autoimmune, but this is when the immune system targets the beta cells in the pancreas and can cause basically lack of insulin, which is type 1 diabetes. Major advances in this. Pretty soon, right now people have to take insulin. They measure their blood sugar. They have to inject with insulin or they have an insulin pump. Pretty soon there are these artificial pancreas that they're developing, which will just be implanted under the skin and serve as your pancreas and just begin to deliver insulin just like you would your own pancreas. Talk about a major improvement. You know, people with type 1 diabetes, their lives change because it's such a labor-intensive disease to have. So again, as Dr. Ahearn said, my passion has always been lupus, and just to show you what can happen, this is Juliet, another patient of mine. She was in high school in this picture, and she was recruited to play basketball. She was a star athlete in high school and was recruited to college, and right before she left for college, she developed lupus. And throughout the years I've been caring for her, and she's had all the manifestations, kidney disease and premature blood clotting and skin rash. There's some devastating skin rashes. And this is Juliet, right? So this shows you this scarring skin rash that lupus patients can get. And the reason I show you this is more because this is what motivates Dr. Ahearn and I to say, this can't happen, right? We have to be able to intervene before these things happen. Other things that can happen in these diseases, this was fluid around the heart, pleurisy or pericarditis, mouth ulcers. Remember Jessica who had the premature coronary artery disease? This is a coronary artery with a plaque, an atherosclerotic plaque in there that ruptures because it happens prematurely in these young women. And this is a premature stroke, which is another problem in patients with lupus. This is why we do what we do. And you know, the good news with lupus is until 2011, we had no new treatment for lupus approved by the FDA for 50 years. 2011, we had our first drug approved, and now we've got 30 companies developing treatments for lupus with 2 that will likely be approved in the next year. So a lot of movement happening in autoimmunity. So diagnosing autoimmune diseases can be challenging. To me, some are more straightforward. If your blood sugar's high, type 1 diabetes, it's pretty easy. Hashimoto's, people go for a while sometimes before people think of Hashimoto's or think of thyroid, but once they think of it and they diagnose it can be relatively easy, and obviously psoriasis is a rash you can see. However, diseases like relapsing polychondritis with subtle findings, as Nancy was talking about, or lupus that can present like anything. We say lupus patients are like snowflakes, right? No two are alike. And if you're not tuned in to be thinking about them, you're not going to diagnose them because there's no blood test that tells you you have it. So this is our challenge. It's getting physicians aware of it, but I say don't wait for your doctor. You become your own advocate and you ask questions and you find the answers yourselves, because the more educated you are, the better. And I also, especially for the nursing students here, but for everybody, we do have help in diagnosing. And I'm going to show you a slide. I don't want you to think you got to look at it or understand all of it, but it's just to make an impact that there are blood tests that we can do that measure the antibody, the autoantibody that is associated with a disease. So, for example, we can check your blood for antibodies to this JO1, and it'll help us diagnose you with inflammation of your muscles. So you can see autoimmune thyroid. These markers are antibodies that help us diagnose vasculitis. And down here, there is a blood test for celiac. It's positive in 98% of people with celiac, but you have to be if you're gluten-free when you get this test, it may not be positive. But at any rate, there are things that help us. And what's interesting is that we can measure these autoantibodies in a test tube and help with diagnosis. This is an ELISA, and it's looking for this MPO antibody, which we see in vasculitis. And interestingly, in about a third of people with relapsing polychondritis as well can have overlapping vasculitis. And we can also, as I showed you with that kidney, we can also see this green? These are blood cells, and the green is the antibody targeting your cells. It's showing the attack against self. And so we can measure these to help us, and they have been quite helpful. So people always say to me, how are we doing in terms of treatment overall? And I always show this picture because I say we have some major hits, and we've had a lot of misses. right? So we've had great advances in type 1 diabetes, rheumatoid arthritis, psoriatic arthritis, inflammatory bowel. We need much more for relapsing polychondritis, for lupus. A lot of other diseases out there now need a lot more attention. And what we're trying to do now is move away, because when your immune system is attacking self, you know what we used to do was go in there with a cannon and just suppress your entire immune system. Well, what happens when you do that? You get infections, it causes all other problems. Now we're trying to target, laser target treatment as opposed to global. And again, another slide that's busy, but hang in there with me for a minute. The only thing I want to point out on this slide is that every single one of these cells is now a target that we can develop drugs to treat autoimmune diseases. So it's very focused. So it preserves the rest of your immune system to fight infections, et cetera. So you can target B cells. You can target the proteins that the B cells make that cause inflammation. You can prevent these autoantibodies from being made. There's so many different targets. And now the drug companies are in full speed ahead developing drugs that can target these different areas of your immune system, which is wonderful. They're doing a great job of that in cancer. And so I just want to end, and I'm going to turn over to Dr. Ahearn, that, our passion has been not just doing research and focusing on autoimmunity, but trying to really change the way people are cared for. Because I believe healthcare is broken, in my own humble opinion. As good as we are as clinicians, the system itself is broken because it's just too hard to navigate, and people get lost. This doctor's not talking to that doctor. Or, your patient comes in and you're trying to throw medications and write a prescription, and they're depressed. And they've got all kinds of stress in their life, and they're barely listening to you. I mean, it's this idea that we've got to get better at treating people, not diseases, because diseases come in people. And so we are trying to do that at Allegheny Health Network. And just to show you, Allegheny Health Network is here, and we are now, Highmark is a Blue Cross Blue Shield insurance plan that actually partnered with us in 2013. So now the payer that pays for the care has partnered with us who are delivering the care to try to get it right? Because you know how often you have to ask your insurance company for permission, right, to get this and that? So we said, well, if we come together, maybe we can eliminate that. And it's been quite good. And so we have been on this pathway of transforming healthcare. And I'm going to show you the next slide to show you how we've done it in other chronic diseases, and now we're going to move into autoimmunity, and we've just gotten a significant amount of support to do it. But I only show you because I think we have to do this model across the country. So our idea is we need to provide you as a patient value. We want you to have good outcomes, but we have to be cognizant of cost. You can't afford co-pays, and how much does healthcare cost? It's terrible, right? So we want to give you the value equation. And what we want to do is provide value to you as our customer. We want to use data to help us do it. We want to make sure that no matter what doctor you see, you get the best care. So we're going to standardize care. So it's not this doctor's doing that and that doctor's doing that. We're going to try to do evidence-based care and bring it to you. We want to make sure we put teams around you and make it easy for you, because it's hard. It's too hard now. And we also want to make sure your insurance company pays for it, so you don't have to pay for it, and that the products that you get from your insurance company help you. And to do that, we're working on how we can take every patient we have and risk stratify them. Do they have severe diabetes, or is it mild? Do they have an active form of polychondritis or not? And once we stratify them, we can then get them on the right pathway. And with that pathway, we can give them a very unique prescribed plan of care. And what we want to do is make sure that no matter where you go in the health system, if you show up in your primary care doctor's office or the emergency department or the hospital, everybody's following that pathway, right? It's not you have to tell your story a million times and nobody gets it. So we're going to carry you through all of these different sites of care and keep our hand on you. And you know what's interesting? It takes a team to do that. And you know who leads our teams? The nurses. So the head of our teams are nurse navigators, and they are absolutely indispensable in my mind. The physician has a tiny piece, but our nurses have a huge role. The pharmacists, social workers, behavioral health specialists also help us. And so we have made some major improvements in COPD and congestive heart failure. You can see how we've been able to treat diabetes. We have 15,000 people on these pathways in other diseases. We've been able to reduce this hemoglobin A1C as a marker of diabetes control. So the idea here is we got support to do this, and now they're giving us support to move it into autoimmunity, the same team-based approach. So we are very excited to talk to you a little bit about changing healthcare, and I'm going to turn the podium over to Dr. Ahearn. Thank you.
Okay, so that's the challenge. And so Dr. Manzi and I said, okay, it's time to walk the walk, and we have to transform autoimmunity healthcare. So I'm going to go very quickly through the past year and a half and what's happened to just give you a taste of how we're doing this, and we're extremely excited. Highmark Health, Allegheny Health Network, they've invested over $30 million in our efforts with the Autoimmunity Institute. So this is our ribbon cutting, May 24th, 2018. We have the president of Allegheny Health Network, president of the hospital. You'll recognize this guy here. And then we have friends and family of autoimmune disease who've been affected. One of our hospitals in Pittsburgh, this is the hub that I'm going to tell you about. This is West Penn Hospital. So this is unprecedented and literally unique in the world. There's never been anything like it, and we're extremely proud. And I'm going to tell you some of the aspects of why it's so unique. First of all, this is the footprint. This is the Autoimmunity Institute here. Here's your waiting room. There are 16 exam rooms. There's an infusion suite. There are no physician offices. Zero. What we have is a huddle hall. And who gathers in the huddle hall? Our specialists, all in one location. So you heard this doctor's not talking to this doctor. Well, here they do. So this is when we launched. You can see the specialties here. As of yesterday, this is our signage. So every physician, every provider that a patient might need is here for 100 plus autoimmune diseases. And so multiple sclerosis, we have the neurologist, we have the rheumatologist, we have the endocrinologist. So it really is one-stop shopping. We have centers of excellence so far for lupus, RA, IBD, and celiac disease, with more on the horizon to launch next year. And our driving force, patients first. And as you heard from Dr. Manzi, we treat the disease, but we care for the patient. And caring for the patient is what's gotten lost. So I'm going to go through this very quickly, but we're all about team-based care, and we have an amazing team. I'm just a facilitator. I'm the chair of the Institute, but I'm really just trying to facilitate all the moving parts. Dr. Manzi leads the clinical care efforts, the research efforts, and we have trainees and nurses. As you heard, nurses are driving this. And our challenge is we don't have enough anyone. We need to recruit at all levels. And I'm going to tell you what the experience has been so far. It all starts at the front. Actually, it starts before the front desk. It starts when patients call us and tell us their stories. And Dr. Manzi and I each actually tried to call patients who are coming from a distance so that we can tell them what they can look forward to. So this is not our customary uniform. This happened to be St. Patrick's Day, as you might guess. But when patients show up, we train our front desk that we're the hospitality industry. We have to be Disney, Four Seasons, Ritz-Carlton. Our patients have been through a lot. And you'll see where they've come from. This isn't their first stop. Often it's been years. They have anxiety, they have depression. They come in, they might be angry and cursing and yelling, they might be crying. They're family members. Often it's sometimes easier to be a patient than a parent or a spouse of the patient. So they're going through an enormous amount. So our front desk, I say, you're the first faces they've seen, the first voices they hear when they come here, and you're going to be the last ones when they leave, so you need to be great. So they have boxes of tissues, but they are spectacular. Some of our other team members, this is just part of the team with a local TV correspondent, Lisa Sylvester. They did a program of us on Pittsburgh television, but really spectacular team. So I told you about the huddle hall. So not only do we have all the specialists, but we also have all the providers. We have the nurses, the nurse navigator. And here's a glimpse of the huddle hall, which runs around the entire outside of the suite. So the patients traffic through the center, and our providers and staff, they huddle within the hall here. And so we're developing, as you've heard we've done in COPD, diabetes, heart failure, we now have our Autoimmunity Academy. So not only do we have the physicians, the multi-specialty doctors, but we have this team, which again is run by a nurse navigator. We have our behavioral health specialists. So many of our patients have anxiety, depression, fatigue. And typically what will happen is you'll treat the disease with one of these biologics, and you hope the anxiety, the depression, it all goes away. But often it doesn't. And it's not specifically addressed. It's just felt to be the baggage that goes along with having a chronic disease. But it's not actually addressed. So we have a behavioral health specialist. We have a clinical pharmacologist to help the patients with side effects, juggling all their medications, social worker, dietitian. Here's Dr. Manzi with our behavioral health specialist, Jenna. She gets rave reviews. Patients love her, and we need more Jennas. And for the whole experience, as Dr. Manzi mentioned, we need the medical technology, but we need patients to understand how, even though genetics, environment, hormones, quote, cause autoimmune disease, it can be influenced by lifestyle factors. And these are generally ignored. But among our team, we have alternative medicine, what we call integrative medicine. We have acupuncture, we have massage, we have Tai Chi. Huge interest now, patients, not just celiac, but all autoimmune disease. How will their diet and lifestyle influence? And so we paid a lot of attention on lifestyle choices, healthy foods, exercise, and it has enormous impact. And patients love this. And they say, well, no one has really told me about how this can happen. So people say, well, do we really need an autoimmunity institute? What's the evidence for this? You know, we could have done a lot of socioeconomic studies and data analyses. What tells us we need this? So we've been open for 15 months, and we have seen patients from 29 states, including Alaska, Hawaii, Texas. You can see the map. In 15 months. Why do they come? They don't know what their diagnosis is. They've been going for years. They still don't know what they have. Their therapies aren't working. They have no one quarterbacking their care. They have a PCP, but the PCP doesn't have the records from all the other specialists the patient's seeing. Before a patient comes, the first thing we say is, we need all your records because we want to make it an efficient visit. That's sometimes the biggest delay in getting an appointment, is just trying to get their records from all over. So they come to us, and we can see them, and we can have all the specialists see them at one time. So the response is, I could spend the entire hour just telling you what the patient's responses have been. I'm going to, in the interest of time, I'm just going to put them up here. You can read them for yourselves. After you get through the first few, it's more of the same. And again, I could have a whole deck of slides. I hope you can see these, but basically it's been overwhelmingly positive. Patients say things like, I didn't even know something like this existed. I didn't know you could get health care like this. It's been years of hell, and finally I'm getting some answers. And most commonly, patients say, I might not have all the answers yet, but I'm confident I'm going to get them here. And even if I don't get all the answers, thank you just for listening. Again, this hasn't been their first stop. Patients coming from Alaska, California, they're not coming here for their first visit. They've been to the named places, but they say, no one's listening to me. It's so rewarding. And so within Allegheny Health Network said, we gave you $30+ million. What's the impact? You show something like this, say, yeah, okay, we are a destination, and as you heard earlier in the video, we have patients calling us from other countries now. A patient from Beirut has Lebanese health insurance, but wants to come in and pay out of pocket. Our patient from Alaska, I'm not going to read this, but it goes on and on, raving about Dr. Manzi, but also this patient saw our gastroenterologist, Dr. Abdubaki, our neurologist, who's a headache specialist. So many of our patients have chronic headaches that haven't been explained. And when this patient from Alaska left, she said, I'm coming back for all my appointments from Anchorage. We had a patient from Hawaii, the whole family came, they bought one-way ticket, and they spent several days, and they said it was even better than we expected. So we're so thankful, but I'm telling you this because, as Dr. Manzi said, we think healthcare is broken. This has been expensive, but in the long run, we will decrease the cost of healthcare and improve outcomes, and the return on investment will be enormous. So in finishing up, I have to tell you, we can't do this alone. And as you can already appreciate, we've had an amazing partnership with Race for RP, the Relapsing Polychondritis Foundation, and we literally have no greater ambassador in the world than this guy, Mike Lynn. So this is at our ribbon cutting. Mike spoke, and we had only known Mike for a few months at that time. But he, being a race enthusiast and devoted brother of a patient with autoimmune disease, Mike has really taken this on his shoulders in an enormous way. I could spend the whole talk just telling you what Mike has done, but I'm going to just tell you very briefly of this extraordinary, inspiring, powerful partnership. I had never been to a race before. I went to this race at Mid-Ohio. Kyle Marcelli, the driver of the Lexus car, I'm in the pit, and they win the race, and it was so fast and so loud. It was extraordinary. And then this past March, Mike hosted an event in St. Petersburg, which was the first IndyCar race of the season. And rather than tell you about it, I'm going to finish up with a very brief video.
This is St. Petersburg, Florida. This weekend is the start of the IndyCar Championship for 2019. IndyCar is essentially the pinnacle of open wheel racing in North America.
We're here to celebrate and draw attention to the groundbreaking work that's being done at the Allegheny Health Network Autoimmunity Institute so they can continue to recruit world-class physicians to help for the patients that desperately need the care.
Autoimmune diseases have been in the shadows for quite a long time, and it's interesting because collectively they're more common than cardiovascular disease. And there's more than 100 different autoimmune diseases, 50 million people in the United States. Autoimmune diseases tend to be very difficult to diagnose. The patients get lost in the healthcare system. We decided to create the Autoimmunity Institute to end all of that. So we brought together, now it's up to 15 actually, subspecialists or special doctors that work under one roof and can see people that have a variety of different problems, make an accurate diagnosis, and get treatment started quickly.
The AHN Autoimmunity Institute is, again, the first of its kind to hopefully be that one-stop shop where you can go and get the answers that you need.
I think what we bring to the table is not only all of the specialists treating people, in the same location, but we also couple that with on-site research. As soon as someone walks in the door, we can get them involved in our research registry. We can tell them about research they may be eligible for. So it's pretty seamless, and I think that's unique to our institute. ARDA has been the best partner we could have had for launching our Autoimmunity Institute. They're the only foundation in the world that really focuses on autoimmunity as an entire disease spectrum.
When ARDA told us that there was a brand new Allegheny Health Network Autoimmunity Institute, we were thrilled. So we reached out to them and said, hey, would they like to join us at a race? It happened to be a race at Mid-Ohio, and Kyle was racing the Lexus.
It was a pleasure and an honor to carry the AHN Autoimmunity Institute brand on the side of our race car last year at Mid-Ohio. But it was very special, I think, to have Joe there for the first time, to see the Autoimmunity Institute logo on the car, and then to have it end up in victory lane at the end of the day. You know, our goal was just to drive some awareness as to what they're doing in Pittsburgh, Pennsylvania at the West Penn Hospital.
We have been thrilled to participate in the world of motorsports.
We're very excited about Scuderia Corsa's IndyCar program. So last year they were in the Indy 500 and they were leading the race for quite some time. It was really fantastic. This year they're fielding the number 20 on the street courses for a full season. Scuderia Corsa is also going to run in this year's Indianapolis 500, so we're looking forward to that. We're really thrilled and grateful for the support that Scuderia Corsa has shown us.
It's an amazing, intense, and passionate experience, and it mirrors the passion and intensity that we carry with us in our race with autoimmune disease.
So tonight we're going to have a wonderful series of boat parties in the marina right outside the Vinoy Hotel. We've got our world-class researchers here and have an opportunity to talk about the good work that they're doing. We have our best friends in motorsports here, Kyle Marcelli, the autoimmune disease ambassador.
So a big part of what I do, not only on the track but off the track, is I carry the Race for RP brand.
Race for RP is the Race for Relapsing Polychondritis, so it's a grassroots awareness campaign to draw attention to relapsing polychondritis, which is a rare disease that attacks the cartilage.
It can be devastating, it can be fatal. We believe it's probably not as rare as people think, it's just that it's being missed by physicians because they don't recognize some of the early symptoms.
Relapsing polychondritis is a particularly important challenge.
We believe that if you can find the answers to why people get relapsing polychondritis or how you can treat it most effectively, those discoveries are going to impact other autoimmune diseases.
And those clues are pieces of a puzzle.
Many people have more than one autoimmune disease, so it's very common. Once you have one, you may develop another. Having all those specialists there, you can diagnose and manage any of the diseases.
We have already been referred and cared for patients from more than a dozen states.
It has been very fulfilling to hear patients respond to their experiences at our Autoimmunity Institute. Having many specialists under one roof is, to be honest with you, the most difficult thing to do, but the one critical ingredient to be able to really make a difference in people's lives.
I don't know what lap we're on in our race, but I do know we're going to finish the race and we're going to win this race. That partnership, I truly believe, has been destiny, and it has led Mike Lynn, Dr. Manzi, and I to partner with the concept of autoimmunity racing. You heard we're not sure what lap we're on, but we have to go. It can't be business as usual. We need a sense of urgency. We have to get this job done. So it's been an extraordinary experience. Here's some images from that weekend. You heard, I said 12 states. That was just earlier in the year. That was earlier this year. So now we're at 29. Soon we'll be at 50, and how many countries. But we can't do this alone. This partnership is thinking outside the box. We never would have said, we never expected a Mike Lennon family and RP Foundation to step forward, but it's just the start. So we have to put ourselves out of business. That's the goal. No more Jessicas. And I will leave you with this. I don't know if you can read it. It says, "My name is Hannah. I made butterflies and sold them to raise money for lupus. I hope it helps. I'm 6. My mom has lupus." So last year, Hannah left for college, and last year her mom died. So that's why we're here. Our biggest limitation right now is we need more everyone. We need more nurses. We need more physicians. We need more social workers. We are at capacity in just a year and a half. And so with that, I will say thank you for your attention. Congratulations, and go Wildcats.